If you're a dentist long enough, you will encounter dental trauma as a percentage of the emergencies you see in your dental office. Accidents happen all the time, and patients will show up at your office looking for help and guidance. It is your job to examine the patient, accurately diagnose their condition, and render the appropriate treatment to the patients experiencing dental trauma. If you're like me, you realize that these patients come infrequently, but they do come. In the patient's time of emergency, I don't want to be caught off guard and potentially render inadequate care. It is for this reason that I compiled the Dental Trauma Guide and subsequent Dental Trauma Worksheet to help guide me through the patient encounter. We are in a time when it is highly encouraged to treat medicine, and dentistry in this case, in a similar way to the airline industry. The airlines are incredibly detail-oriented and check and double-check before they take off. They have extensive checklists. And why? I mean, because lives are at stake, right? And a small oversight can lead to a big problem. We should think similarly in dentistry and medicine because our patients are people and they matter. I have adopted this mindset with my dentistry, and I have been creating checklists over time that aid in guiding my thoughts and my mindset through various patient encounters. For this course, I created the Dental Trauma Worksheet, a form that guides my thought processes for a dental trauma encounter. This form ensures I don't forget something, and it holds me to a standard to do a robust, detailed examination. If you adopt this mindset and use tools like the Dental Trauma Guide and the Dental Trauma Worksheet, you will have more predictability and detail incorporated into your encounters with these types of patients. And it will make these appointments more efficient and eliminate waste, which leads to production and business benefits as well. Other reasons why I created this guide and worksheet is because I struggle to remember some details, especially numbers. Always have. A patient comes in with a lateral luxation. What radiograph should I get? And how many total radiographs should I get? How do I splint the teeth and for how long? What are the recommended follow-up times and what should I do at these future visits? Have you ever experienced that? I mean, really, and at that moment you realize, man, I really need to look this up so I am better prepared the next time this happens. Personally, I wouldn't say I like that feeling, and part of me knows I could have done better even when I get a good outcome, regardless of being ill prepared. In the remaining videos, I am going to walk you through the worksheet and the Dental Trauma Guide. And truthfully, you could also just pick up the worksheet and the guide and just read through it at your own pace. Although, I highly recommend that you spend a decent amount of time looking at the guide and the worksheet, so at those future patient encounters, you are very familiar with the guide and have a good idea of where to look for those on-the-spot reminders. Like I said earlier, it is not always how much you know at the moment, but knowing where to find the information you need quickly. Throughout the course, please let me know if you have any questions or comments by placing them in the provided comments section below, or you can email me at jason@comprehensivedentist.com. My name is Dr. Jason Bullock, and this is the Dental Trauma Mini Course.